Hello and welcome to Early Bird by Amerisleep. My name is Dr. Devon Hoffman, and today we're going over lymphedema or swollen legs and the implications with the Amerisleep adjustable bed frame. We've done the research so you don't have to lose sleep over it. Now, swollen legs are a very common issue around the US and other countries. A lot of these problems come from the amount of time that we're spending with our legs either not moving or below our heart, leading to a lot of fluid accumulation in the lower limbs, basically so that it can't be pumped back. Now, the fluids in our body, despite what many think, are affected by gravity, so they get pulled down toward the ground throughout the day, and the only thing that actually pumps them back are our veins, basically, and our lymphatic system. So our veins do have valves, so once they do pump it up, it cannot go back down toward our feet. That being said, a lot of times the gravity is so strong that it actually wins more fluid than it disperses, so you end up with swollen limbs, or if you have lymphedema, you might have some lymph swollen down into your lower legs. Now, lymphedema is specifically for those who might have an anatomical damage to the lymph system, while swollen legs can happen from various people from poor circulation or a lack of movement. So make sure that you consult your primary care provider if you do have any of these before trying any of these techniques out, or learning more information about what level you're at and if you do have potential damage to this area. Now, that being said, a lot of these issues can be solved by simple movement routines as well as proper sleeping positions, and today we're going to go over the Amerisleep approach as far as using the adjustable bed frame to improve these symptoms and allow for the fluid accumulation to return back toward your heart. Now, the adjustable bed frame is awesome for this condition because, as you guys can see on other videos on the website, the feet and the head can both be elevated, which is amazing for providing basically a fluid track for gravity to actually assist pulling a lot of the fluid out of the lower limbs and back toward the heart so that it can be redistributed and filtered through. Now, for a lot of the clients and patients that I've had with this condition, a compressive therapy can also be very, very helpful in helping to squeeze the lower extremities and push the fluid down toward the heart and away from the lower extremities. Staying in the Amerisleep bed with the adjustable legs elevated for around 20 to 30 minutes, you should notice a great difference in the amount of swelling that you have in the lower limbs, and being able to do certain small exercises like ankle pumps while in this position with the legs elevated can be awesome for helping to speed up the process and help get pain out of the feet, ankle, and calves. And for many of you who do have soreness in this area after standing or sitting all day, this is a great option at the end of the day to relieve. Kick your feet up, watch a television show or something like that, and help relieve some of the soreness that you might be having. Now, looking at some other causes and treatments for lymphedema and swollen legs, doing simple exercises and stretches can actually use what we call a muscle pump to squeeze the veins and actually push some of the fluid against gravity back toward the heart and out of the legs. So people that do consistent walking or stretching tend to have less fluid buildup and retention in their lower extremities and better circulation. So now let's dive into some other frequently asked questions about this condition and see if we can help you guys out. The first question is, how can I prevent this issue from ever happening in the first place? So my favorite recommendation as a physical therapist is to recommend that people take brief breaks every 30 minutes to do a short walk and activate the muscles of the lower extremities to help pump some of this fluid back toward your heart and improve your circulation so you don't get that buildup in the first place. Now, the next question is, how long should I use the elevated bed? Now, putting your legs elevated isn't necessarily bad long term, but usually you only need it for around 20 to 30 minutes like we mentioned earlier. However, people with chronic leg swelling or lymphedema could benefit from a slight elevation throughout the entire night of sleep, as long as you're not noticing any numbness, tingling, or circulation issues in the lower extremities after doing so. Now, the last question is, I have swelling, numbness, and tingling in my feet. Could this be from lymphedema or swelling or something else? Now, there's a lot of different conditions that cause this type of issue, such as diabetic neuropathy and other circulation issues. So it's best to get a consult from your primary care physician if you do have any sort of issues like this. And I would recommend anyone with a severe case to always get a consult with your PCP and use this as a supplement to your care to help speed up the recovery process. Now, I hope this information was helpful today, and if you do have any lymphedema or swollen leg symptom questions specifically, be sure to leave a comment or request more future content about this. and check out the other information that we might have on the Early Bird by Amerisleep website to check out other blog posts and informational videos that could be helping you out get the best sleep of your life. Sleep well, guys, and take care.